Good evening. On behalf of the Association of Black Cardiologists, in partnership with the Baltimore City Medical Society Foundation, we are ecstatic to welcome you to the Spirit of the Heart Community Leaders Forum for our charmed Baltimore City. I am Dr. Saberluzzi, a heart failure cardiologist at the Johns Hopkins University School of Medicine and current member of the Board of Directors of the ABC. This is a particularly special evening for us, as I hope it is for you, because Baltimore is where ABC started its community health initiatives over 45 years ago, when Dr. Elijah Saunders, the first African American cardiologist in the state of Maryland, began using churches and barbershops as hypertension control centers. Ever since, the Spirit of the Heart continues to live on as ABC's signature program, actively empowering and educating community members, faith-based and civic leaders, health advocates, and health providers in addressing local barriers to cardiovascular health that put our communities at risk. We, as members of the ABC, pride ourselves in championing change in cardiovascular health and health equity locally, nationally, and abroad. Over these past 45 years, ABC has led the change and the charge in communities by implementing action, addressing policy, directly talking with legislators, and building a pipeline of cardiologists, scientists, and allied health professionals to raise awareness of the devastating impact of heart disease and disparate outcomes in communities of color. Cardiovascular disease remains the #1 cause of death in the United States. We have to change the narrative of worse outcomes, higher proportion of deaths and hospitalizations, and poor quality of life for Black and Brown people living with heart disease. We are emboldened to stop heart disease in its tracks when we strive to do this by providing you, our communities, with knowledge regarding heart disease prevention, best practices in management, access to care and life-saving therapies, and worthwhile lifestyle changes that are essential for wellness. We hope this event increases your awareness of the importance of cardiovascular disease prevention and highlights a path to a healthier Baltimore for all of us. Share the information you received tonight with your family, your neighbor, your congregation, your sorority, your fraternity, your colleagues, and even your doctor. We hold true to the adage that children should know their grandparents and be great-grandparents too. Prevention and advocacy for the highest quality cardiovascular care right here in our city is the only path forward. Baltimore, we are truly delighted to be here, and thank you for your participation.
Good evening. It's an honor to join you virtually for the Association of Black Cardiologists Spirit of the Heart Leaders Forum. The COVID-19 pandemic has impacted all of us in a variety of ways, but it has sharply highlighted the great disparities in health outcomes that continue to burden minority communities, especially those who suffer from comorbidities and cardiovascular diseases. Today's program will bring together health professionals and leaders to come up with solutions that can be used to address these disparities and close the gap on health outcomes for patients with heart diseases. All of us have a role to play in this very important work, and I want to thank you, our healthcare heroes, for your leadership. I look forward to working with all of you to make progress and continue to fight for a healthier and more equitable Maryland. Thank you.
This is Mayor Brandon Scott, and on behalf of the citizens of Baltimore, I would like to welcome you to our great city and the 2021 Spirit of the Heart Leaders Forum for Baltimore. Tonight, you will discuss how we can address cardiovascular risk factors for our citizens in Baltimore, and as we emerge from the coronavirus pandemic, we want to recognize that health disparities in heart disease were a problem for our communities well before COVID-19. If we don't take the steps to mitigate the circumstances that created these disparities, then the health disparities in heart disease will continue to burden our minority communities. The good news is that there are steps that we can take to begin to address the gaps in care. Cardiovascular disease is a leading cause of death for all Americans, but the burden is particularly high for Black people. High rates of hypertension, diabetes, obesity, and other risk factors to heart health lead to greater disease burden in Baltimore. Since these complications are not identified and treated in Black community members at an earlier stage, it leads to higher rates of premature death for our residents. During the next hour, you will hear from our speakers on the heavy burden of heart disease in Baltimore and how we can use new tools and strategies to begin to reduce these burdens and tackle health disparities together. I encourage you to participate in the program, discuss and think about how we can all contribute to make Baltimore a healthier city. Thank you.